Good afternoon, students. Today we are going to talk about general aspects of the forensic traumatology, environmental factors which cause injuries, outcomes of injury, description of the injuries, injuries caused by blunt and sharp objects, classification of the blunt and sharp objects, bruises, abrasions, wounds, and bone fractures, general aspects of craniocerebral injury. Traumatology is studies about injuries or trauma. According to the character of the environmental factors, the injuries can be divided into physical, chemical, biological, and mental. The injuries caused by physical factors include the following types of traumas: mechanical, electrical, thermal, radiation, and barometric traumas. The injuries caused by chemical factors include chemical burns and poisonings, as well as effect of medicines and gaseous substances. The injuries caused by biological factors can be connected with the influence of fungi, bacteria, viruses, prions, or antigens. The injuries caused by mental factors lead to a mental trauma as a result of fear, fright, or strong inquietude. According to their peculiar features, the injuries are divided into anatomical, for example, wounds, abrasion, bruises, fractures, visceral damage, and functional, for example, pain, shock, or brain concussion. Anatomical damage is manifested by morphological changes which we can determine in a visual or microscopic way. But functional damage does not have morphological changes, and they can determine only biochemically or clinically. According to their consequences, the injuries can be fatal and non-fatal. Fatal injuries result in death of the person, and non-fatal injuries can be divided into severe, medium, and mild body harms. The expert described the injuries from top to bottom according to the following scheme. At first, location of injury, specifying the anatomic site, distance from anatomic points, and certain reference points. Character of injury, for example, abrasion, bruise, wound, or fracture. Form of injury, linear, round, oval, triangular, square, rectangular, or irregular. Size of injury, depending on the form in centimeters. The depth of the wound is determined by the character of tissue forming its bottom, quantity of physical injuries and their interposition, and the characteristic of injury depending on what kind of injury it is: abrasion, bruise, wound, or fracture. Color, character of crust covering a graze, color, density, level of the surface in relation to surrounding skin, character of the wound edges, even, uneven, excoriated, or crushed. Angles or ends of the wound, sharp, blunt, M-shaped, or rounded. Availability of septa, pus, granulation, hair bridges, or foreign bodies. Objects are divided into weapon. It is the most frequent object in self-defense crimes, intended exceptionally for injuries causing. For example, knuckle duster, knife, or pistol. Instruments are numerous objects where are utilized in a technique, production, private life as devices, means of labor, for example, crowbar or hammer. Actually, blunt objects are such objects which don't have special setting, stick, stone, brick, or board, or have special setting, chair or table. However, don't belong to weapon or to instruments of labor, which at certain terms can be utilized for injuries causing. Classification of blunt objects. With a flat prevailing surface of table or floor. With a flat limited surface, hammer or axe. With a spherical surface, dumbbell or weight. With a cylinder surface, stick or pipe. With a trihedral corner, table corner. With a rib or dihedral angle. Edge of brick, edge of hammer surface. The blunt objects include also some parts of a human body. Those are a head, hands, legs, or teeth. There are four types of the blunt object action mechanism. At first, blow. Next mechanism is pressing, stretching, and last one is friction. A blow is short-term influence of a blunt object upon a human body at right or almost right angle. It can cause bruises, abrasions, wounds, fractures, visceral ruptures. Present is a prolonged one-way force action. Present can cause deformation of some body parts, injuries of viscera and bones. Stretching is a prolonged multidirectional force action that can cause skin chaps and tears, lacerated wounds, tearing of body parts and extremities. Friction is influence of a blunt object upon a human body at acute angle. Friction can cause abrasions. These are some kinds of injuries produced by application of mechanical force, blunt object force. At first, abrasion, bruises or contusion, laceration, fracture or dislocation of a bone, tooth, or joint. Abrasion is superficial crippling of epidermis or mucous epithelium that does not affect derma. A scratch is an injury very similar to an abrasion. This is a narrow abrasion of linear form whose width is not significant. The time or age of an abrasion is established based on healing stages. In a few hours becomes dry because of producing a protective covering known as a scab or crust. Before 12 hours, the scab places layers surrounding and damaged skin. From 12 to 24 hours, it places on level of undamaged skin. After 24 hours, it places higher surrounding skin. After 4 or 5 days of inflicting, the scab begins to fall off from peripheral side because of regeneration. To 9, 12 days, scab falls off completely and we can see pink or brown spot in this place. As for medico-legal significance of abrasions, abrasion is a result of blunt subject action. They indicate the site of impact. They indicate the direction of the acting force. The age of the injury can be determined. An abrasion may have a dirt or particles from subjects, which may give a characteristics of subjects. Besides, character and manner of injury may be known from its distribution. In throttling, cransling abrasions due to fingernails are found on the neck. In smothering, abrasions may be seen around the mouth and nose. In sexual assault, abrasions may be found on the breast, genitals, inside of the thighs, and around the anus. Abrasions on the face or body at the assailant indicate a struggle. Abrasions on the victim's body may show whether the fingernails of the assailant were long, irregular, or broken. A bruise is penetration of blood from damaged vessels into subcutaneous fatty, cellular tissue or deeper tissues. Accumulation of blood by mucous membranes is called hemorrhage. Accumulation of blood in a newly formed cavity is hematoma. During a forensic medical examination of a bruise, it is possible to find out the age and the traumatizing object. A bruise is the result of an influence of an obtuse object. Its localization does not always indicate the area of the blow because the bruise can spread itself below the place of the force application. Bruises belong to the light bodily injuries. Sometimes their shape and localization can reflect the peculiarities of the violent act. Suffocation with hands. As for age of bruise, a bruise heals by destruction and removal of the extravasated blood. The hemoglobin is broken down into hemosiderin, hematoidin, biliverdin, and bilirubin by the action of enzymes. The color changes starts at the periphery and extends to the center. At first, red or purple because of hemoglobin is rich on oxygen, oxidative form. In few hours after inflicting, blue-purple because of hemoglobin leaves oxygen, it used by surrounding tissues. To 3-5 days, brown, hemosiderin, greenish, hemoglobin transforms into biliverdin. To 6-8 days, yellow, hemoglobin transforms into bilirubin. In this period, we can see three-colored bruise. On the periphery, brown-yellow. In the media part, greenish-brown. In the center, blue-purple. Such bruise named old bruise. To middle of second week, bruise disappear and skin has normal color. Medico-legal importance of bruises. Bruise is a result of blunt subject action. In some cases, they don't indicate the site of impact because of its movement under the weight of blood. The age of the injury can be determined. Character and manner of injury may be known from its distribution. In throttling, crescentic bruise due to finger are found on the neck. In smothering, bruise may be seen around the mouth and nose. In sexual assault, bruise may be found on the breast, genitals, inside of the thighs, and around the anus. Bruise on the face or body of the assailant indicate a struggle. In manual strangulation, the position and number of bruises and nail marks may give an indication of the method of attack or the position of the assailant. A wound is an injury of skin, mucous membranes, and deeper tissues. Application of blunt objects can cause compound, torn, squashed, flapped, and beaten wounds. However, they do have some common features. Their edges are uneven, stripped, squashed. In the depths of the wound between its edges, membranes of connective tissues, tissue bridgings, are visible, connecting tissue fibers that are kept. If a wound is given in the hairy part of the head, then hair bridges are situated between its edges, and so such a wound is called laceration. General characteristics of wounds caused by blunt objects. At first, edges are uneven, often patchwork. Stripped, squashed, have the place from inferior bone separation. Walls are uneven, squashed. Within days of wound, especially nearer to the ends, there are fabric membranes surrounding fibers of connective tissue that extend from one wound edge to the other. The wound shape and capillarities depend on the traumatizing surface. If the surface is predominantly flat, then the woods are zigzag-like, branched, with twisting, stripped, and partially squashed edges and ruptures. If the wound is given by a flat limited surface, square or round, the wound looks like a rupture with 3 or 4 rays running from the center. If it was made with an object that has limited surface, for example, an edge, a rib, or the surface, the shape of the wound is L-like. Blunt objects with spherical surface mostly cause wounds with 3-4 rays, Y or cross shape. Objects with cylindrical surface cause wounds with rectangular, curved, slit-like, spindle-like shape with uneven wavy or squashed edges and tissue membranes. Objects with ribs create wounds of linear shape with even or acute edges that can resemble shock wounds. A wound heals with a formed scar of reddish pink color. It is dense and is united with the underneath tissues. The approximate age of a scar can be estimated by its aging phase. At first, depending on vascularity, a recently formed scar may appear reddish or bluish. It is tender and soft. The age of such a scar is up to 2 weeks. As the vascularity diminishes, the scar becomes pale and white, but is still tender and soft. Its age is up to 2 months. With time, the scar contracts. It becomes smaller and whiter, but is still a little tender and soft. The age is between 2 to 6 months. As the scar contracts further, it becomes tough, white, and glistening. The probable age is not less than 6 months to an indefinite number of years. As for medical-legal importance of wounds, the type of laceration may indicate the cause of the injury and the shape of the blunt weapon. Foreign bodies found in the wound may indicate the circumstances in which the crime has been committed. The age of the injury can be determined. The degree of wound is minor bodily injury with short-lasting health disorder. Now we are going to talk about fractures. Fracture is partial or complete violation of its anatomic integrity. Fractures can be opened, compound, which are characterized by violation of skin integrity. Closed fracture when skin integrity at fracture place is not broken. Fractures are divided into local or direct, which arise at blow or injuring object pressure place. Remote or indirect, that appear at some distance from the place of force acting. In this slide, you can see types of bond fractures. They are transverse, linear, oblique or displaced, spiral, green stick, and comminuted. Peculiarity of skull bones damaging. Under the powerful action of blunt subject which has flat limited striking surface about 9-16 square centimeters, the bone fracture of skull will be hollow. The form of this hole will correspond to the form of subject, and so we can determine this subject. Under the powerful action of blunt subject which has flat, unlimited striking surface, the bone fracture of skull will be plural fissured, lining, or will have one line. Under the non-powerful action of blunt subject, which has striking surface with edge, the bone fracture of skull will be depressed. The form of this edge will correspond to the form of subject, and so we can determine the subject. Under the non-powerful some actions of blunt subject which has flat limited striking surface or surface with edge, the bone fracture of skull will be stepping. The line of bone fracture directs to the site where the force acts. If there are some lines of bone fractures, we can determine what was the order of their inflicting. The rule is, line from next fracture does not cross the line from first fracture. As for peculiarity of ribs damaging, ribs fracture can appear both in the place of the force application, direct or local fractures, and at some distance, indirect or remote fractures. At the place of the force application, the fracture line on the outer rib surface is uneven. Large teeth with chips and splitting. The fracture line on the outer surface approaches the direct one. A remote rib fracture is also caused by rib deformation, but in the opposite direction. As a result, the fracture line on the outer rib surface is almost even, and on the inner surface it is large teeth. In the picture A, you can see the mechanism of appearing and localization of local rib fracture. And in the picture B, you can see mechanism of appearing and localization of remote or indirect rib fractures. Now we are going to talk about sharp objects, which are things with a sharp edge, a blade, a pointed acute end, or a combination of both. As for forensic classification of sharp objects, they are cutting, stabbing, chopping, and stabbing objects are divided into single or double bladed, with wedges or without wedges. Under the action of sharp subjects produce wounds. Injuries produced by application of sharp edge and pointed end of a weapon. At first, incised wound, puncture or stab wound, incised stab wound, chopped wound, and last one is sewn wound. As for incised wound, incised wounds are formed as a result of a blade being pressed against the body and at the same time moved in longitudinal direction. Such wounds have a linear, spindle-like, or arch shape, even smooth edges and pointed ends. The wound shape is defined with the edges put together. Its length is bigger than its depth and width. At the end of the wound, where the object has stopped cutting, an incision or a notch can appear. If the blade of the cutting object was damaged, then the wood edges can be uneven with small flaps. An incised wound cut, slash, and slice is inflicted by subject to which has sharp edge, for example, knife, razor, scalpel, scissors, or sword. The mechanism of wound inflicting consists of combination of moving and pressing of subject. This action leads to cutting of tissue. Such injury is longer than it is deep. As for incised self-made wounds, it made for the purpose of suicide are situated in easily accessible places where the great blood vessels come close to the surface. For example, on the neck, forearm, or hand. On the neck, they are located on the front, lateral, or frontal surface. On the forearm, the great vessels go in the area of the middle carpal joint. Such wounds are parallel, not deep, with numerous cuts and scratches near the edges and corners. The direction of the wounds corresponds to the physiological direction of one's own hand movements. The wounds that appear during struggle or as a result of self-defense are situated on different areas of the body. They are deep and have different direction. Chopped or hacked wounds are made by a sharp object blade when used with great force or has a large weight. They are deep, gaping wounds caused by a blow of a sharp cutting edge of a heavy weapon like a hatchet, an axe, a saber, or a cleaver. Necessarily, the wound has the damage of the bone in the form of superficial and deep cuts. They are characterized by a significant size, depth, and compulsory dissection of the underlying bone tissue where cuts are formed. If the injury is made by the middle part of the axe blade, the injury is spindle-shaped and with the edges put together. Its shape is linear with pointed ends without incisions or notches. When the person is hit by the tip or the heel of an axe, the wound is of triangular shape with one sharp and one end-like ends. If the whole axe blade immerses onto the body, slot-like wounds with two N-shaped ends appear. As for stab or pierced wounds, they are caused by objects with oblong shape and a sharp end. The injuries have an entrance wound channel and sometimes exit. The wound shape depends on the shape and the cross-section of the piercing object. The mechanism of stab wound producing consists of combination of stabbing and moving into depth of tissue. Conical and cylindrical conical objects create slot-like wounds. Thin objects, a needle spoke, create dot-like and inconspicuous wounds. The edges of the pierced wounds are even, with abrasions, sometimes with layers of substances from the surface of the piercing object. Stab wounds are accompanied by injuries of viscera, blood vessels, and extensive inner hemorrhages. And last one is incise stab or bladed wounds. Are caused by objects with a sharp end and a sharp edge, a knife or scissors, and belong to the most widespread injuries. Such wounds have an entrance, wound channel, and exit if the wound is through. The shape of bladed wound is linear, spindle-like, or oval. The edges are even. The end shape depends on the traumatizing object. For instance, if the blade is double-edged, both ends will be sharp, and if the blade is single-edged, then one end will be sharp and the other will be N-shaped. When the blade is drawn out from the wound, it might cause additional cuts at its sharp end, or the wound may be extended. During an autopsy, the wound depth must be measured and added to the thickness of the clothes. The result can show the general length of the blade. In case of bladed abdominal wounds, the channel depth may be bigger than the blade length due to the mobility of the front abdominal wall. Injuries caused by scissors depend on their position at the moment of the blow. If branches are separated, each of them acts as a bladed tool similar to a knife. The closed scissors acts as a piercing object. When branches open inside the victim's body, a double wound channel is created. Thank you for your attention.